To me, HIMSS is about collaboration. It is an opportunity to meet people who have shared interests in making the healthcare system better through information technology and data.
HIMSS is awesome. This is probably my 18th or 19th time here. The first thing I love is seeing what's the buzzword of the moment. Every year there's a different buzzword.
You're talking about consumerism, you're talking about value-based care, you're talking about the cost of prescription drugs. Talking about general interoperability. These are the things that everybody's after. And I think that if you hear what people are saying when they're on stage, you can tell that all of this is front and center. This issue of adherence is costing the U.S. healthcare system somewhere in the neighborhood of $300 billion a year.
If we did this really well with real-time benefit and electronic prior authorization, if you could get patients on the preferred product that their insurance company covered, that's actually worth another $60 billion. And then if I can drive patients to the cheapest channel to get their drug, that's worth almost another $40 billion. That's $400 billion in savings with better health outcomes.
What does price transparency mean? Well, it means patients only take the medications they can afford. And in medical school, we're always taught about mechanism of action of the drug, how effective it is, but never, can my patient afford it? What's the cost?
What price transparency means to us is having that information that has historically been available at the pharmacy counter and moving that upstream into the clinical workflow where the prescribing decision is made.
With real-time benefit check, I love that doctors can turn their monitor, show the patient, okay, this is what this drug is going to cost, here are a couple other options, let's think about this, let's talk about this together, what's going to work best for you?
As a physician, I want to affect change, make the patients better, and now I can do that at a price they can afford. So this is a real game changer for all of us.
If doctors, pharmacists, and others don't have the right information at their fingertips, often at times when they need it immediately, there's no time to spare, we could really be facing some serious safety issues for individuals.
Especially with critically sick patients, I've always felt like it's practically a moral issue to put the burden of bringing their data in-house on the part of the patient, and we as the industry need to solve that.
Record Locator Exchange is turbocharging the information that we're getting on our patients who are seen in other hospitals across the country, so it goes beyond state boundaries and HIEs.
I see Surescripts as an invaluable partner in terms of nationwide interoperability. The numbers are staggering. The last I heard literally just a few minutes ago is you're over 300 million patient records. That's a large number of folks in the U.S. that are covered. So that reach is now at a critical mass.
Surescripts is really held up as a beacon of wonderful information exchange that flows seamlessly. It's available at the point of care, and in our meetings on Capitol Hill and with other government officials, I mean, those folks even hold up Surescripts as an example of interoperability really working, and it's wonderful to see.